My name is Jacqueline and I'm going to talk to you guys today about the new RNS system for epilepsy patients. So, epilepsy patients have about 3 different ways of going about their treatment. So either they get on some anti-seizure medication, which is the most common, but it does come with a lot of side effects. The second one is epilepsy surgery, which is a lot more invasive, but it is ideal for those patients who have a more severe case of epilepsy. And then the last one is the RNS system, which is the new device that I'll be talking to you guys about today. So, unfortunately, epilepsy is a very common neurological disorder which affects about 50 million people worldwide today. And it can come about and be either hereditary, caused by a genetic mutation. It could also occur from a previous brain trauma, so either a tumour or an infection, or it could also be caused by any abnormal developments to the brain. And 1/3 of patients who have epilepsy are actually resistant to anti-seizure medications, which means that systems like the RNS can really help those patients. So the way that doctors diagnose patients with epilepsy is through studying their brainwaves through an EEG machine. So if they see that the patients have large depolarization followed by many subsequent action potentials for each individual neuron, they can see that that's what a pattern will look like during their seizure. And if the patient will have more than one unprovoked seizure within a span of 24 hours, or one very serious seizure with a high chance of reoccurrence, then the doctor will diagnose them with epilepsy. So the most common type of seizure is what we call a partial seizure or partial epilepsy. So what that means is the seizures are confined to one specific lobe in the brain or one side of the hemispheres in the brain. And so there are 2 different types. So we have simple and complex. So the simple partial epilepsy means that when the patient's having their seizures, they retain their consciousness. And when it's complex, then the patients either have impaired or a total loss of consciousness during their seizure, which means that they won't remember much at all once the seizures are happening. And the way that we classify type seizures and types of epilepsy is based on the location that it happens, and then also the physical or mental shows of their symptoms. So this is the chart that we use to classify seizures. So the first one is a focal onset seizure. So it's also known as a partial seizure or partial epilepsy. Then there's also generalized onset seizures, which happen in both hemispheres of the brain. And then we also have an unknown onset seizure, which means that it can happen anywhere and we don't really know the cause or why and when it happens. Now, all of these types of seizures can also show very similar signs of symptoms. We can either have motor or non-motor types of symptoms. So the most common motor symptom that we see in patients is called tonic-clonic. So what that means is a tonic seizure is when a patient's muscles will stiffen and then flex. So what that means is the patient will then tend to fall backwards. And a clonic seizure is what we typically think of when we say seizure. So we will see the patient falling on the ground and then having violent shaking or convulsions in their body. So tonic-clonic is just a fusion of both. So the physiology of epilepsy revolves around these 2 ideas here. So it's either hyperexcitability of neurons or a deficiency in its inhibitory response. So with hyperexcitability, glutamate is our main excitatory neurotransmitter in the brain, and NMDA is its primary receptor that responds to this neurotransmitter by flowing in calcium ions. And the positive ions will then create these signals in the brain, and that's what we see on the brainwaves is all the depolarizations. So with epilepsy patients, what we see is that they have very fast or long-lasting activation of the NMDA response, which means that a lot more calcium will be coming in, and then we have a lot more of those depolarization waves seen in the brain signaling. If that's not the case, then it also could be a dysfunctioning inhibitory response. So GABA is our main inhibitory neurotransmitter, and GABA receptors allow the flow of chloride ions to come into the brain. Now, the negative ions inhibit our cell signaling, which means that if there's too much calcium, it will be able to inhibit it by flowing in chloride. But epileptic patients, if they have dysfunctional GABA receptors, won't be able to inhibit that flow of calcium in, which will then also again lead to that high depolarization. And then the symptoms that we can see through both these responses of physiology is either outward or inward signs of symptoms. So either physical signs of jerking, moving, or losing consciousness, or even inward symptoms of the patient feeling a strong sense of fear or smelling strange smells. So this is the new RNS system, and what it is a little lobe that's stuck onto the skull of the patient. So it doesn't need to remove any brain tissue, so it's not very invasive at all. And it's known as the world's only brain-computer interface for treatment or refractory epilepsy. And how it works is that it continuously monitors the brain waves of the patient, and then it will recognise the seizure onset fingerprint, which just means what the brain looks like before a seizure can occur. So then the machine will send pulses to that area, or to the lobe, or to the certain side of the hemisphere, in order to stop the seizure before it can even occur. So, with a clinical trial that we've had, within an 8-year follow-up, we've seen that patients have had a massive high rate of success, with some patients even having a 90% seizure reduction within a 3-month period, which means if a patient were to have 10 seizures in 3 months, it would then reduce to about 1. And we have a lot of quality of life improvements as well, such as in cognition, physical health, mental health, and less seizure worry. Thanks.